Thank you. Dominic.
Just on that, Keir Starmer pointed out today that the death rate in care homes has been running at 3 times its average, and in April reached 26,000 people. But coronavirus was only blamed for 8,000 of those deaths. What is killing the rest?
Jenny, do you want to
Shall
answer that?
It probably goes back to the question before about how you count deaths. I think what we're saying is 8,000 were confirmed linked with COVID. And actually what that means is they were associated with COVID. It's slightly different. Those individuals had a diagnosis, they had a laboratory confirmation. They could have died from something else but had COVID, or they could have died from COVID. And then the gap that you recognise, actually the same applies, but we don't have a test for those individuals. Some of them may well have had COVID. Some of them may well have died from other issues. And that's why it's so important that we look at this whole excess mortality. It's very likely that some of those individuals had COVID, and that may apply to other parts of the population as well. The important thing is whether they had appropriate care and treatment. I think the other point is, which you're perhaps referring to, is we are really mindful as we go forward from a health perspective, as a health professional, to understand and ensure that people, wherever they are, whether it be care homes or the general public, continue to use emergency health services in the way that they should do. And it's important that people do consult them. So we do know that there has been a drop in usage, for example, of A&E, hospital admissions, for what are normally urgent issues. So there may be a proportion of individuals in there who have not accessed health services normally. It's why it's really important that we look at that total excess mortality over time. We encourage care homes and the general population to use our health services normally where it's an emergency, and that we continue to count those cases where we can.
Thanks very much, Ian. Our last question is from Derek Healy, and Derek is from the Dundee